keep your distance, and wear a mask. It's the advice that's been given to millions of people around the world. And following that recommendation has become, for many, the norm. But others refuse to comply.
When you wear a mask, which you can certainly do, you are further pushing the agenda that is condemning all of us.
6 months into the pandemic, the use of face masks is still up for debate. So, is the recommended approach still the way to go? Welcome to your COVID-19 special here on DW. I'm Chris Kober in Berlin. I'm tired of breathing through them. You might be as well. But experts say not wearing face masks during the pandemic isn't an option. And then there's the US. Nowhere is the discussion around wearing face masks probably as polarizing as in the United States. Far from being merely tired of them, many people simply have never wanted to wear them.
Are you going to allow the government to tell you you have to wear a mask? No! The time is now. It's time for action. Thank you guys very much.
AntiMaskers, people who, against the wide consensus of public health experts, either want to limit mask wearing or are against them completely. Many of them use similar reasoning.
At the end, I don't wear a mask for the same reason I don't wear underwear. Things gotta breathe.
I can't breathe. I can't breathe. Insanity.
I have a breathing problem. My doctor would not let me wear a mask. So anyone harassing me to wear a mask, you guys are violating federal law. Do you get that? Get that on camera. Ma'am.
And on the other side, critics have been taking the country's most prominent anti-masker so far to task, in increasingly creative ways.
Just stop drooling and slow down the pace. Just cover your freaking face.
Wearing a face mask, I don't see it for myself.
Cover your freaking face.
I'm choosing not to do it.
He might have even gotten the message. He started to change his tune as of late.
I mean, I'd have no problem. Actually, I had a mask on. I sort of liked the way I looked. Okay, I thought it was okay. It was a dark black mask, and I thought it looked okay. It looked like the Lone Ranger. But no, I have no problem with that. I think, and if people feel good about it, they should do it.
However the president's decreasing aversion to masks influences attitudes, it will probably be mandatory mask-wearing policies that will make the difference. The number of states requiring nose and mouth coverings like New York and California are increasing. But calls are getting louder for a nationwide masking policy. Proponents say national measures would decrease infection rates and save the country from another round of shutdowns and an estimated $1 trillion hit to its economy, something most people would welcome, maybe even anti-maskers.
Let's talk more about this with Siddhartha Verma. He is an assistant professor for ocean and mechanical engineering at Florida Atlantic University. Welcome to DW, Siddhartha. You examined the effectiveness of various types of masks and found significant differences. Which was the most striking result to you?
So the most striking thing was how little effect a very thin single-layer fabric has. No doubt it is better than nothing. So any sort of face covering is better than no covering at all. But the effectiveness can depend a lot on the type of fabric that we use, if we are using cloth-based masks, and as well as on the fit on our faces. So with most masks, we noticed there was a lot of leakage from the top, where the mask basically, there's a gap between our nose and the mask. So it's important to have both a good fit that's comfortable as well as use good, tightly woven fabrics.
So what would be the best fabric in order for the mask to work properly?
The best fabric that we tested was actually 2 layers of quilting cotton. They were just stitched together and we fitted snugly on the face. And you could see that the forward motion of the jet was restricted to barely 2 or 3 inches. and that turned out to be the best. Yeah.
So if I have a mask like that or any other type, how can I test if it is holding back aerosols in a proper fashion?
So some people have suggested a very simple test would be hold your mask up to a light, and if you see that the mask blocks the light well, it's likely to be more effective.
Okay, what about wearing your mask with your nose out? Does that make any sense at all? If you go out on the street, you see people doing that.
I have seen some people do that, and no, you should keep your nose covered by the mask for two reasons. First, when we exhale, if we are infected, we will definitely exhale the virus-laden droplets out. And another risk is masks do prevent the wearer to some extent. So we would be protecting ourselves by covering our noses. So we minimize the amount of droplets that we breathe in as well.
And as these masks come in many styles and fashion, Siddhartha, what is your mask of your choice?
I actually wear a surgical type mask, and it's because they are easily available, but I have a few homemade masks as well. So I switch out between these types.
All right, Siddhartha Verma of the Florida Atlantic University. Thank you for talking to DW.
Sure, thank you for having me.
Now, wearing your mask is particularly important when you cannot keep your distance, because sometimes we have to visit these crowded places, like a train station, for example. Now, a startup in Munich is focusing on a new pedestrian control system to ensure that people will not have to pass each other in close proximity and still get to where they want to go on time.
Preventing potentially dangerous crowds. That's what this team of computer scientists and simulation experts is working on at Accurate, a startup based in Munich. The corona pandemic is also demanding that they take a few steps into the unknown. The team usually calculates evacuation plans and security measures for major events or passenger flows. What's new is that they now want to protect passengers, employees, and visitors from COVID-19 as much as possible. The corona crisis in particular has shown us that simulations now not only help with crowds of people, but they can also help us to see how many people we can fit in a room while observing social distancing rules. So it concerns office buildings, but also train stations, so that passengers can travel safely. The simulations are based on projections. Human avatars, so-called agents, follow lifelike movement patterns. Here we already have built-in social distancing. That means we have a green circle around a person with a diameter of 3 meters or a radius of 1.50 meters. How are they all supposed to get out now? And here I can already see that maybe these people are going to come out too, but they'll have to wait a bit. Who will actually go through a 1 meter wide door first if I have to keep a 1.5 meter distance? And you can see that the agents turn red from time to time. That means they've been under the minimum distance for a while. The test avatars are still moving about without fear of infection. Researchers are focusing on a new pedestrian control system to ensure that in the future, people will not have to pass each other in close proximity to reach their destinations on time. We are already seeing queuing systems everywhere in our daily lives, whether it's the entrance to the supermarket and so on and so forth. I think the research work we're talking about has something to do with the queuing system and actually tries to capture and describe what's happening there. And the findings can, of course, help us to plan queues with a different set of objectives. The minimum distance can even shorten travel routes and waiting times. In train stations or mezzanines, the one-way street regulation can stop people getting in each other's way when getting off or changing trains. The Accurate team combines user information and architectural data, which it hopes will help facilitate a return to normal. And that means pedestrian traffic, and with that public life, could flow a little more smoothly again.
It's Time now to answer your questions about COVID-19. Here's our science correspondent, Derek Williams.
What are the risks of sharing bathrooms with non-family members, like at the office?
This question has been coming up a lot ever since the publication of a new study on the physics of how aerosols are generated when you flush the toilet. Chinese researchers who modeled it discovered that every time you flush, without closing the seat cover, it sends a plume of aerosols up into the air, which will hover for minutes and then eventually settle on surfaces, with other studies indicating that the virus might at least sometimes survive passage through the digestive tract. Suddenly, those public facilities we all need to visit once in a while look like a potentially dangerous environment, especially because many public or shared toilets are also enclosed, windowless spaces. That said, the experts that I've read on this mostly don't expect them to become hotbeds of infection, probably because everyone's grown so leery of using public facilities. If you have to, though, you should, of course, take the standard precautions, particularly when it comes to washing your hands afterwards. But hopefully you were doing that anyway.
Are there any indications that COVID-19 causes brain damage, or does it only affect the peripheral nervous system?
It can affect both. Our views on what this virus does to the body continue to evolve, but we now know that it's far more than just a pumped up version of a cold virus that only affects the respiratory system. It can affect many different organs, including the brain. Current estimates say that around half of all COVID-19 patients with severe cases will display neurological symptoms at some point, either due to low oxygen levels in the blood or the body's own inflammatory response, and that they could also sustain neurological damage, often from strokes, but also possibly directly from the virus itself. It now appears that at least in some cases, SARS-CoV-2 crosses what's known as the blood-brain barrier, which usually protects the brain from invasion by pathogens. The problem is that neurological symptoms and their causes are notoriously difficult for doctors to track back and to quantify, which is why we haven't heard that much about them so far during this pandemic. But because neurological or nerve damage can cause lifelong problems, many experts believe that COVID-19 will leave behind a devastating legacy that we'll only discover in the years to come.